COVID was a once-in-a-lifetime pandemic that impacted all of us at Cape Cod Healthcare. However, once we realized that we had the necessary processes and procedures in place, that we could safely take care of patients and protect our employees, that we had the necessary PPE, that we made sure that we could test, that we could treat, that we could quarantine, that we could create negative pressure rooms. Once we knew that our staff was well trained and our physicians were well trained and we had the resources that were necessary to take care of our community, it was time then to look to the future. And part of our future was to improve the way that we deliver healthcare. In order to do that, we needed an integrated electronic medical record. We needed an electronic medical record that could help our employees, that could help our physicians, and also help our patients. We needed to make sure whether you were in the ambulatory setting, the inpatient setting, in the ER, or in oncology, that everyone had your information, the patient's information at their fingertips, to improve the way that we could provide the care, that physicians could talk to one another seamlessly, that staff could communicate with physicians, that everyone across the continuum could feel a part of the patient's journey. That was our goal, and that's why we continued on with the EPIC project. We knew we could have the resources, and we knew that we could safely do it. Part of what we plan to do is to provide the adequate training space, whether in person or virtually, to ensure that you're safe, to ensure that you're ready, and to ensure that our organization can improve the way that we provide care. EPIC supports us by improving the way that we provide care. That's our mission, to improve the quality of the lives of the people on the Cape, to ensure that they can receive exceptional health care each and every time they come to one of our doors. EPIC provides us with that opportunity. Again, it's an integrated electronic medical record, best of breed. There's no one better in the industry than EPIC, and we were fortunate to be a part of the journey with them. To provide this electronic medical record here to the Cape helps patient care, helps the employee, helps the physician, helps all of us improve everything we do. Not only on the clinical side, but also on the revenue side, which is also so important today, to ensure that each and every activity we do is adjusted for and accounted for, so we can also make sure that we're compensated so we can further the mission of this organization. EPIC is a profound piece of our future. However, people are still the bedrock of what we do, and we're excited to be able to provide this to you. A key component to choosing EPIC was the patient portal, called Mychart. It provides the patients an opportunity to control their own healthcare, the scheduling of tests, to understanding their lab results, to making sure their pharmacy orders can be done, to ensure that they have all of their patient information at their own fingertips, to be able to do a query with their provider, to be able to make sure that they're actively communicating and helping to navigate this healthcare experience. The patient portal was so unique and so strong that it actually played a key role as to why we chose EPIC. Healthcare is changing at a dramatic clip. It was changing quickly before the pandemic, and post the pandemic, it's changing even more quickly. We understand better now how you have to integrate, coordinate, and communicate, whether you're on the Cape, whether you're in Boston, or whether you're in Naples, Florida. This EMR gives us the ability, no matter where you go in the country, to have information, our patients' information at their fingertips, to make sure that we're sharing all of our test results, all of our imaging studies, all of our diagnosis with other providers around the country to better the way that patients receive care. Our country has changed over the past 50 years. So much is changing daily. And for us at Cape Cod Healthcare, evolving, meeting the needs of our patients, of our providers, of our community, has to be paramount in everything that we do. This new EMR, EPIC, is a key part of that.
Well, we are in the end stages of a 16-month timeline to get EPIC live here at Cape Cod Healthcare. You know, we started back in summer of 2019 with the initial organization and design, and we built the system. And then we were hit with the COVID pandemic, which really deterred a lot of clinical operations, in particular their participation from the project. Between now and November 1st, we have to finish training. And that's no small undertaking, having to train over 5,000 folks in use of the system. It's brand new, we've got new workflows, and we had 30 different systems and everybody had different ways of doing things. And now we're all in the same sandbox, we're all in the same boat. And so it's a lot of change around that. So we do need to wrap up training.
We're currently training about 5,000 employees going on over the next 6 to 8 weeks, right up until go live. And then after November 1st, we're going to be working with our new hires and making sure that they're ready for go live, and also making sure that our current employees get their optimization training. So working on tips and tricks and how to really maximize our use of the system effectively. We have a lot of resources available on our Vision 2022 website. One of those for training is really the training playbook. It has a lot of answers to questions, all the frequently asked questions, how to prepare, what to experience in training. Virtual training is new for everybody in the organization. The overall goal of training, as we're delivering it right now for the implementation, is to get that core base experience level so users can access the application and perform their workflows at a basic level. No one's expected to be an Epic expert on day one.
We have no immediate plans to implement Epic at JML. We do anticipate in 2021 implementing Epic for the VNA, actually, which would be an early 2022 go live. And we do anticipate making Epic available for our independent community-based medical practices starting in spring. We'd start implementation with hope of getting the first few practices live by this time next year.
Super users will be deployed before, during, and after go live to their departments or specialty areas. They'll be at the elbow support to answer any questions one might have.
Super users are our own teammates that have additional training than the rest of us will have to be here to support our go live, but then I think more importantly help us as we enhance the system going forward. They'll be here as a resource that we can tap into, and after the Epic and Deloitte and other teams leave, they'll continue to lead the charge so that we can get the best use out of Epic possible.
Super users are often the go-to people in their departments. They're approachable, knowledgeable, and highly respected by their team members.
Initially, on the go live period, it's going to be a very hectic time, a very exciting time. A lot of preparation has gone into this event, so it's going to be fun, it's going to be exhilarating, and we really all just need to work together as a team to make sure that it's a success and that we're all comfortable. It's going to be a lot of change, but we have a lot of preparation for that change that we've been working on. So the day before Epic Go Live is really when all of our over a year's worth of planning comes together. All as a team between IT, operations, and all of our third-party counterparts come together. We're going to start with all of the transition parts, such as transitioning over all of the appointments and patients' information that wasn't part of our original conversions, and really getting started with the Epic process.
There's a lot changing in the revenue cycle, and we're very excited for Epic. I mean, with the implementation, from the time we schedule the patient till actually the time the patient's billed, everything within the revenue cycle is changing. So as we receive the bills from the insurance companies, we'll be able to actually then produce statements for the patients that will consolidate all their services under Cape Cod Healthcare. In the new system, you'll get one statement that will outline all the services that were provided to you at Cape Cod Healthcare, and it'll be a much easier process for the patients to understand really what their out-of-pocket liabilities are.
Epic will have the ability to send out reminders. This has been a lot of interest in this area as patients want to be part of their, healthcare, and this gets them another way to get engaged in the process.
I am most excited about Mychart. Mychart is the online tool for patients to manage their healthcare. They can access their electronic medical record 24/7 from their desktop or from a mobile device. They can see their medications, they can see lab results, they can communicate with their healthcare team with any questions that they have through secure messaging.
So the Mychart patient portal that Epic offers is going to do a lot for our patient population and our clinicians. Number one, I'm excited for better communication with our patients. This is 24-hour communication, meeting patients where they are. And rather than calling the office once or maybe multiple times to get an answer, they can take an action right there when they want to do it. I'm also excited for how the patient portal, Mychart, will streamline our registration processes, our administrative tasks, and our workflow for our own staff and clinicians. And I'm also excited because the Mychart patient portal allows patients to be more engaged with their health, and we know that more engaged patients lead to healthier patients and better outcomes.
We're looking for 40% of our patients to be enrolled in Mychart, which is a pretty big goal, but I think it's something that we can achieve if we're all pulling together and telling patients about it.
Staff will have such an important role in the adoption of Mychart. Staff, through our e-learnings and our training, are going to be taught how to activate a patient for Mychart, and it is so simple. Right from the patient storyboard, in one click, we can register a patient either through email, text, or by printing the instructions. Patients are also automatically activated into Mychart. They get an invitation every time they check out or check in or are discharged from the hospital. That will automatically go to patients to encourage them to sign up.
Think about how you use technology each day. You read the news, get in touch with family and friends, make reservations, and even order groceries. Did you know you can use Epic's Mychart on your phone, tablet, or PC to stay connected to your healthcare? Let's say you have a symptom. Maybe don't search the internet. Instead, send a secure message to your care team. You'll get reliable advice and next steps. If you need an appointment, schedule from wherever you are, without a phone call. If an earlier time becomes available, you'll be alerted so you can be seen more quickly. And even check in ahead of time to avoid waiting in line at the clinic. If getting to the clinic is impossible and you don't need to be seen in person, request a video visit. When it's time to pay the bill, go paperless and pay it securely and quickly. With Mychart, your clinical information is always available, from visit information and lab results to a list of ongoing care needs, immunizations, medications, and more. If a medication is running low, there's no need to call the pharmacy or doctor's office. Simply request a refill. Plus, Mychart syncs with your fitness device to update your medical record with your daily health habits and activity. If the need arises, release your health data to any provider with internet access, no matter where you are. And let's not forget about your family. Whether you're in charge of rambunctious children or helping an aging parent, review and manage their care and yours, all from a single portal. And through one Mychart account, you can even see health information from other places where you and your family receive care. Mychart, your secure online health connection.
Our Epic will be integrated with the Mass Highway for immunization records, and right from Epic you can use a hyperlink to go to the Mass Highway and see patient immunizations.
The beauty, I think, of the Epic implementation is that on November 1st we'll go from a hodgepodge of disparate record systems, including legacy systems and paper, to a unified, integrated medical record for that'll cover essentially the entire organization.
Epic is a unified patient record. which means that we will have the ability to look at a patient's record all the way across the spectrum of healthcare. So as an inpatient doc, I'll be able to see outpatient records and outpatient problems and how the patient was treated over the last multiple years so that we can provide consistent care across the entire spectrum of care.
Right now, we all need to be training, okay? We all need to access our HealthStream accounts and run through the modules that are there. They're excellent. They're actually very easy and intuitive to run through. They don't take a particularly long period of time. You can do them in between patients or at the end of the day, 1 or 2 at a time. And they're really informative. They've helped me move along through my process of learning Epic, and I think they will help you too.
I think the day before, it's about making sure you've done everything that you need to do to be prepared to go live, right? Have you taken responsibility? Have you tapped into your resources? Have you done your homework, and are you ready to go? I think the day of, it's important to take a deep breath. Let's all recognize that we're implementing a record across an entire organization. We are going to go live, we are going to be successful, and we are going to raise our hands and tap into our super users or to the command center with any issues, which will be addressed. And I think the day after is then really about implementation and how do we take great care of our patients and how do we identify where we need to go next.
One of the most important things you can do with implementing any complex product is to have good governance going forward, and physicians need to be a very strong component of that governance. So when things are broken, we need to reevaluate what the product is, find out what's broken, and then have consensus within physicians on how we're going to fix it to still provide that best practice. Right? So we will have a significant physician governance going forward for things like order set creation, order set modification, without a lot of red tape. Right? And I think we've created a pretty good process on how to do that, and a lot of people are going to need to be involved.
I think that we do identify that it is a learning curve, and our opportunity here is to be clinicians and to be leaders and to recognize that the way we keep patients at the center and at the focus of everything we do is by not ever having those conversations in front of a patient. The utmost important thing to me, that our patients never feel a blip in our day, and it's our responsibility as clinicians to ensure it.
We really need to get in the mindset of saying, look, this is going to be the way we do business going forward. So if we get in that mindset, pay attention to all the emails that come out, look at what it is that you really need to be doing right now. Prepare for training, get ready for training. If you're not going to train and you're not going to be ready to use Epic, you're not going to have a login to use Epic, and you won't be part of our community.
On-site support at Go Live is going to be very robust. We've identified many super users throughout the system who will be at the elbow support for Go Live. And these super users are from inside Cape Cod Healthcare. They're identified people that are already specialists in their field, both clinical and non-clinical, who will be there and dedicated to help us all when we go live on November 1st.
Cape Cod residents, if you're a patient at a Cape Cod Healthcare doctor or hospital, you can manage your healthcare online through our new, easy, and secure patient portal called Mychart. View test results, message your doctor, refill your prescriptions, and so much more right from your smartphone, tablet, or computer. Signing up is easy and fast. Take charge of your healthcare. Register today at capecodhealth.org. Mychart.
Epic, I think, once you get used to it, it provides a great basis for future admissions. And here on the Cape, we see a lot of patients more than once. Once you get the information entered, it's easy then to follow that patient.
Epic has a lot of benefits. Well, communication is a big one. It's easier for providers to communicate amongst each other and be aware of the other information and what patients have already been going through prior to meeting them.
I think from a physician perspective, we're going to have at our hands much more information quickly. The system is fairly intuitive in terms of finding things. You can hover over an area and it will pop up and tell you what it is. From a single screen, you'll be able to scan down and get a summary of the patient. You'll be able to see old notes at a click. imaging at a click, all of it from one screen where you're not hunting and searching or potentially going out of your current EMR to another EMR to have to Sorian, for instance, to try and find lab results or scans.
I would do things the right way to begin with, because then it becomes habit. There's a lot of options to kind of verify that you've reviewed material. If you just get in the habit of doing things right the first time, it's much smoother.
When I was in residency, I transitioned from using Sorian to Epic, it was a major step forward in the ability to deliver care, I felt. I felt that we were able to better communicate with patients. We were able to become more efficient as we built out our templates over time. And as you get more used to the system, you can become quite facile with it and quite efficient. And I think it provides safety and good communication amongst providers and also with patients.
We wanted to provide you with this tool to better the care that we provide, to make sure that you understand the importance of it, and also the fact that change will be there. But make no mistake about it, this new electronic medical record, once we adjust to it, will improve everything that we do, will help us coordinate the care so much better, will help us communicate so much better, and will lead to better outcomes for our patients. We want to make sure our community knows that we're there for them 24/7. And this electronic medical record will help us in that journey.